kick off in December to amplify that message of safety. Our employers were already doing it throughout the state. They were showing public health and the governor that the safest place to be, quite frankly, at the beginning of this pandemic, was at the workplace, whether it would be a hospital, whether it would be an energy company, whether it be a manufacturing facility. We are proud of the record that our employers, the Ohio Business Roundtable, have shown since this began. We began to amplify that message in December. Our employers across the state, whether it be hand washing, whether it be social distancing, whether it be washing hands, not just in public, but in private, become leaders within their social circles, not just with their friends, but with their family, right during the holidays, quite frankly. And we feel good about the 160 members that have signed up for the coalition beyond Business Roundtable members throughout this state. They are small businesses, they are associations, they're public entities, associations. Great feedback. We have a website, we have a toolkit. It's basically employer-based education campaigns throughout the state, and its focus has been quite well received on safety, awareness, public health practices, and now we're beginning to change that message, continue that message, but also supplement that message with what public health and the governor are beginning to do with the vaccines. The vaccines obviously are really an important part of getting back to normalcy. There's been great reporting on the effectiveness of the vaccines. And so we're going to continue to promote safety, social distancing, mask wearing, but also the goal is community immunity. And quite frankly, it's our civic duty as business leaders in this state to try to help public health and pivoting that campaign to widespread acceptances of the vaccine. So our panel today is going to share with you how their employees are getting involved, how employers are getting involved in this new phase of Stop the Spread initiatives that we began in December, and why it's so important for employers and the 5 million people who work for Ohio businesses to be leaders in this vital effort to stop the spread of COVID. And so with that, let me introduce my chairman, who is the CEO and chairman of American Electric Power here in Columbus, Ohio, Nick Akins, to kick us off.
Thanks, Pat. Almost had to say, please take it off the mute, but thanks everybody for joining us, and thanks again, Pat, for your leadership on the Ohio Business Roundtable. There's no question that the community of companies in Ohio have really come together to focus on this effort because it's critical to the improvement to our society, getting back to normal and actually seeing the benefits that we all want to ascribe for in the future. So American Electric Power serves 11 states. 11 primary states. We're in 38 states, but the primary is in 11 different states. And we see various ways in which our employees are focused on these types of activities. We started early on with the federal government and others working on getting lists together of our essential frontline workers. We have 12,000 employees working from home. And that process has continued almost a year now, which is amazing. And when you think about those kinds of activities that are in place to make sure that happens, if anyone goes to the office, we make sure that there's temperature checking, all the hygiene activities, social distancing, all those CDC recommended issues we mandate when they go to our office. And certainly, as we look at the frontline employees, our frontline employees are critical to the business of providing electricity 24/7. And in the kind of weather we're having, it's great to have electricity, by the way. But these workers come together, they work very close in many ways. And it's important for us to make sure that those hygiene activities, the distancing as much as possible, the mask wearing, all those issues remain clearly in place, regardless of whether a vaccine is available or not. We're trying to step forward with communications to our employees very early on we were talking about the vaccines, when they would become available. We actually had an employee and her spouse on our intranet talking to employees. They were actually part of the COVID vaccine trials and explaining their experience and reiterating the need for everyone to take a vaccine when it becomes available. We're also working with the communications aspects to our employees to ensure that they know we strongly encourage the vaccine to be taken. I have been on our site with our company doctor talking about frequently asked questions relative to the vaccine. He has followed up with continued discussions with employees about that to make sure that we get out in front from this various activity that's actually going to be important for us to get back to normalcy from a business perspective. We also have when the time comes, we want to make sure we try to make it easy for the workforce to get their vaccines. So whether it's time off, we're looking at various incentives to ensure employees really focus on getting the vaccines when they become available. So we don't want to have the rejection rate be so high that we have an issue going forward. So we're working with local, really local providers, healthcare providers, to come to our sites and give the vaccines. And hopefully we get sort of a mass type of maybe peer pressure or those kinds of things to really encourage employees to make that. So it's really about accessibility. It's about getting the vaccine as quickly as possible. And it's about being accommodating to employees with different work schedules to ensure that they have the ability to get the vaccine when it becomes available. The other thing too is safety is a big issue for AEP. Obviously with electric safety, zero harm is something we strive for every day. We also talk about leadership when it comes to safety. And it's not just leadership inside the company, it's leadership outside the company. So we want our employees to exhibit that same leadership quality from a safety perspective when it comes to vaccines. There's no better message for us to show by actions, not only in the communities we serve and internally within the company, to show that leadership, and everyone can be a leader from a safety perspective. So it's incredibly important for us, and we've married that to our statements regarding safety for our employee population. So as we move forward, it's going to be incredibly important for us to make decisions about accommodating employees, ensuring that they're able to get the vaccines, and also ensuring that there's proper incentives for them to do so. And we're obviously looking at the various incentive mechanisms that can be put in place. We're not going to mandate, in our company, we're not going to mandate vaccines, but we're going to strongly encourage it, and we're going to provide incentives and really focus on our ability to bring employees together as a family and ensure their own personal safety, but the safety of others as well. And that's an incredible part of what we're going to do. So again, it's about education, it's about our safety, our own personal safety, and then ensuring that employees take the vaccines when it becomes accessible. I'll be doing it with an intranet webcast when I get the vaccine to demonstrate to employees. My executive officers will be out in the field with employees talking about the vaccines as well. So we have a lot of work to do, but I'm sure we'll make considerable progress. And with the help of the Ohio Business Roundtable, from a state perspective, there's no question that we have the opportunity to make some real progress in our rural communities as well as the urban communities. Thanks.
Thank you, Nick. Well said. Next up, we have Mary Miller, the CEO of Jancoa Janitorial Services in Cincinnati, Ohio. Mary's employees can't work from home, most of them. So that's a big challenge. So Mary, thank you, a member of the Cincinnati Regional Business Committee. We appreciate you joining us today on this call. Mary.
Thanks, Pat. And that was exactly my number one point I was going to say. My team members can't work from home. We have to do our best to keep them safe. Nick, I love what you said about bringing your employees together as a family. We're a family business that next year we'll be celebrating our 50th anniversary. My husband started our business when he was 19. Today we have 500 team members that are out in the community trying to make sure that everybody that does go to work at their offices or go to pick up something or to have a meeting can go to a place that has been disinfected and cleaned in a way that their health is safely. And the business owners and managers, property managers, know their assets are protected, that we can make sure that all the different pieces of the puzzle are working properly so that when people do come back to work, the office is a safe place to return to. It's been such an important piece to keep our team members safe from the very beginning. The communication that we do to our team is imperative because there's so much misinformation out there. And it's important for us to make sure that we lead by example. All of us business leaders and anybody that has influence on somebody else is a leader. So we have to lead by example and be careful of what we say and how we say it, because we can incite fear more so than hope. And that's our role, I believe, to help with the community immunity, is to bring hope and possibility that they can be safe while they're doing their job. And that was what will bring our economy back and the world back to more of a normalcy than what we've had. Early on, before it became a mandate, we knew that our team members that are out in the field needed to have masks, but they weren't to be found. So my vice president of business development had the great idea to create a sewing team. And we had 6 different people sewing and cutting material, including myself. I made about 700 masks for our team members and their children, since I wasn't doing networking and getting out there like I normally do. So in between Zoom calls, I had the sewing machine going. We have to do what we can. We distributed bags to our team members with hand sanitizer and disinfectants and even toilet paper, because we wanted to make sure they had what their family needed. So we're trying to build that trust. So our team members, if they have questions, instead of listening to cousin Joey saying, oh no, you don't know what's in that vaccine, you don't want to do that, that they have hope that this vaccine, along with the mask and washing hands and social distancing, will give them that safety that they need to take care of their families. Because nobody dreams of being a janitor, but they should be able to go to that job and be safe in doing so, to take care of everybody that goes to that workplace with the assumption it's going to be safe and clean, so they can do their job of what they're meant to do. I was recently with my 89-year-old mother, and she was telling me she didn't know she was going to get the vaccine. And I'm like, why? She said, well, she listened to a podcast with some religious leaders, and I'm not sure what they put in that stuff. So people are looking for answers, but they're not looking in the right way. And if we don't communicate in a way they can understand, they're not going to do what would help them to keep safe and healthy and their families safe and healthy. So I think this kind of messaging is so imperative to be able to give that done. And I'm going to lead by example. Nick, I don't know if I'll be doing a live stream, but I'm definitely going to be having pictures and communication out there, so my team knows my husband and I will be, as soon as we're available, we're going to get the vaccine, and we'll make sure everybody else does and encourage them to do it as well.
Great message, Mary. Thank you so much. We were fortunate to have a partner of ours from the Ohio Hospital Association. Mike Abrams, the CEO of the Ohio Hospital Association, has really elevated the organization since he arrived several years ago. And he has been right by our side as we began the coalition to stop the spread. He participates in our weekly meetings. He is a valuable part of our network, and he's just been an inspirational leader in the healthcare community. And Ohio hospitals are lucky to have him at the helm. Thank you, Mike, for joining us today.
Well, thank you, Pat. I really appreciate the great work of the Ohio Business Roundtable, and we're so proud to partner with you on this important work. What I'd like to do, if I may, is remind us of a couple of important facts from public health history. In the 19th century, 300 million people across the world died of smallpox. That's about the population of the entire United States today. Unlike COVID, smallpox was actually more deadly to young people than older people. In the early 1980s, smallpox was declared eradicated from the face of the earth. In 2016, measles was declared eliminated in the Americas, though it began to show up about a year later, usually associated with someone bringing it in from another nation. But the eradication of smallpox and the elimination of measles both occurred due to an aggressive vaccine campaign. In the case of measles, we needed to vaccinate more than 90% of our population to bring about broad community immunity. Today, obviously, we're faced with a different virus, a virus that has killed 445,264 Americans and 11,430 Ohioans. We know what we need to do to eliminate this virus. We will need to vaccinate more than 70% of our citizens. And at that point, we'll be able to resume all the things we want to do. Like everyone else, my family has stories about the things we had to not do over the past 11 months. Funerals that weren't held, weddings that were postponed. We celebrated the Thanksgiving and Christmas holidays very differently this year. Our son graduates from the University of Dayton this year, and it's my hope that we can pile into UD Arena and watch him march in pomp and circumstance and get his degree. The numbers seem to indicate that while COVID is still very present in Ohio, we are detecting improvement. 2,380 people from Ohio are in the hospital today. For comparison, in mid-December, more than 5,300 were hospitalized. We don't want to return to those kinds of numbers. Since the onset of the pandemic, our heroic hospital employees have cared for more than 46,000 COVID patients. The beginning of the vaccine campaign was in mid-December, and that gives us a big reason to be optimistic. This week, we're vaccinating people who are 70 and older. Today, 1.7 million people in Ohio are eligible to be vaccinated, and we have vaccinated about 25% of them. Next week, an additional 655,000 people will be added when the age requirement drops to 65. The rate limiter now is the amount of vaccine available. It can only be described as a trickle, but I'm optimistic that that trickle will become at least a strong stream, if not a flood. Whereas now we're working only with the Pfizer and Moderna products, we expect 3 additional vaccines to come online in the coming weeks. Johnson & Johnson is expected to ship an additional 125,000 doses per week to Ohio starting in March. Both AstraZeneca and Novavax are expected to be coming online with their vaccines soon after that. So there is reason to be optimistic. And there are things you can be doing now, now to prepare, even if you're not in an age category that allows you to schedule a vaccine. First, you can learn. If you have concerns about whether you should become vaccinated, you should learn from trusted sources until you're comfortable. Talk to your own personal physician or maybe a nurse who's been on the front lines taking care of COVID patients. But ultimately, I hope you decide to get vaccinated. It is safe for you and your family, and it is the best choice. Second, you can plan. Figure out where the vaccines will be offered in your community and how you can get registered at the site you prefer. It might be the hospital or health system in your community. It could be your local health department or a pharmacy or a Kroger. Wherever you decide to go, learn what their process is. Soon after you've learned and planned, the opportunity will be presented to you, and before long, we will be able to pile into Nationwide Arena and scream at the ice and cheer on the Blue Jackets or go to a UD basketball game or whatever it is we want to do. Meantime, thank you for all you're doing to help prevent the spread of the virus. And thanks again to Pat and the OBRT for inviting me to participate in this conference.
Thank you, Mike. Thanks for your continued work. In batting cleanup today from Cleveland, Ohio, the CEO, the president of Metro Health, Cleveland's public healthcare system, Dr. Boutros has an incredible personal story matched by the incredible turnaround that he's achieved in the 7 years that he began leading the effort at Metro Health and piloting, quite frankly, a sea change that many thought was impossible. Dr. Boutros, thank you for your leadership, not just over the last 7 years, but since the start of this pandemic and what you and your team have done up in Greater Cleveland. Dr. Boutros.
Thank you very much, Pat. I'd like to start by saying that, our healthcare workers have been recognized as heroes all along this pandemic. I want to thank Mary and Nick's frontline staff who are not seen in the same light often, but they're out there putting themselves at risk for our community. And honestly, without Nick's team and the electricity that they provide, we're going to run hospitals. And without Mary's team, we would not be able to have safe for people. So I just don't want us to forget about all the wonderful people in Ohio who have done tremendous work to keep us and our families safe during this time. Metro Health is the oldest health care system in Northeast Ohio, 183 years old. And we have been involved in massive vaccination efforts and polio, TB, smallpox, all sorts of things that we've been to. So we have a lot of experience. And before the first shipment of vaccine came, we started working and talking about why each one of us would be as willing to get the vaccine. We started with a video campaign, which was called Why I'm Getting the Vaccine. And we started with posters and people showing their reasons why they would do that, for their family, for their friends. We also worked with the greater Cleveland pastors, who many are African American, many people of color, and we had them. We were able, after we vaccinated our employees, to be able to vaccinate some of those pastors, all of them 65 and above, some of them in their 90s. And we showed them on video getting vaccinated, and they talked about why this is important. And it's especially important because the COVID disproportionately impacts communities of color. So there are a lot of myths out there. I'm not going to go through all of them. I heard lots and lots of them. It's not going to change your DNA. That's that's one of my favorite ones. And I said if it did, I would actually take it so it can help me become a better basketball player, thinner, taller, more handsome, and it doesn't do that. A lot of folks think that 95% immunity means that you're playing Russian roulette, like you don't know if you're immune or not. No, 95% of the people are immune. So and the 5% who aren't immune actually even have significant benefits. And some people think this has been rushed. And I can tell you is that the science is rigorous, the research is extraordinary. We've looked at this and it is very, very safe. It's very well thoroughly tested options. So, and everyone who's going to get the vaccine, here are the three things that are going to happen to you. One, you will be absolutely less likely to get COVID. Okay, that's the first thing that's going to happen. You will be absolutely less likely to transmit the virus to someone else. And you will absolutely be less likely to get very sick from it and require hospitalization. So how do we know this? Here in Ohio, we know this because in about 4 weeks' time since we started vaccinating nursing homes, we had a 75% reduction in the number of people who have COVID in the nursing homes. So for over a 4-week interval, we've been vaccinating, and look at how well it controlled the spread of the virus. So I would say, irrespective of this, in the meantime, please remember the 3 W's: wear a mask, watch your distance, and wash your hands. And if you don't, if you can't assess the benefit of this, let me tell you, these 3 W's have reduced the influenza rate at Metro Health by 99% compared to last year. A 99% reduction in influenza infections, not just hospitalizations, just pure infections. Every person who comes in to be tested for symptoms today at Metro Health gets simultaneous COVID and influenza vaccines, influenza testing. And we know we're a 99% reduction today. So I would also tell you this, whether it's my 24-year-old daughter or my 97-year-old dad, we are all will be first in line to get the vaccine as soon as we are permitted. So I can tell you it's safe. It is good for you. It's good for your family. It's good for your community. And we are, as people, we need social interaction. This prolonged isolation has terrible impacts, not only on our economy, not only on our health, but really our future. And we need to be able to get to that community immunity that everyone has spoken about as quickly as possible. And I believe as people see their neighbors getting vaccinated and they do well, as you see their pastors getting vaccinated, as Mary's employees see her getting vaccinated and Nick's employees see them getting vaccinated and that they are doing well, they will get there. And I'm also very proud to tell you, we've been vaccinating people 80 years or over, and there's a lot of in the press about how the communities of color vaccination rates are significantly lower than white vaccination rates. I can tell you is that so far, we have had a higher uptake because we put on a campaign to make sure that folks understand what's going on. We have had a slightly higher uptake by the communities of color, African American and Hispanic and Latino communities than we have in the white communities. And we are vaccinating very readily. So we're vaccinating about 5,000 people every 2 weeks, depending on the supply. And that supply is supposed to be increased. So we're going to go out there and we're going to do some great work. And before you know it, as Mike Abrams said, we'll be back and watching the Cavs in person win a championship.
Thank you, Doctor. That was a great message. We're proud to have you as a member of the Ohio Business Roundtable. Thank you so much. Great comments, Nick, Mary, Mike, Dr. Boutros. We'll open it up, Sandy, for questions to any of these folks on the line with us today. So just go ahead and unmute and ask your question to one of our panelists. Well, you all did such a good job. Left press stumped.
No questions.
Sandy, do you have anything to add?
You know, I would just encourage our media to encourage your readers, listeners, viewers to also, in addition to heeding all of these great pieces of advice, to encourage people to help their family members who are currently eligible. We all know that we have to be patient, but there are 80-year-olds and 70-year-olds who are eligible who may not have the resources to navigate signing up, getting an appointment, getting transportation to a site, checking in on an elderly person once they've had the vaccine, making sure that they get back. We're encouraging our employee workforce to obviously be patient for their turn, but also while they're waiting to really look at their family and anybody that they might be able to help get the vaccine who is eligible. So that would just be one thing I would ask if you could suggest that in your media reporting. That would be very, very helpful as well.
Great comment, Sandy.
So
Last chance, any questions?
Hey, Pat.
Yes, Nick?
If I could just add one thing, I think it's clearly important as these reports are put out on what's been said here. It's really everyone's civic responsibility to do this because there are so many parts, and we're seeing it in our business. The commercial organizations like obviously restaurants, bars, big box stores, some of these are really having an impact because of what's going on here, and it's getting more acute all the time. Industrials are trying to make their way back, and our commercial customers obviously are lagging because of the issues. In the schools, everyone hears about the schools. So I think the civic responsibility of everyone, it's essentially a wartime effort for us to step up and be a part of that process to ensure that we move as quickly as possible back to a functioning society.
Well said. And last point to what Mary said earlier, in terms of information, this is where the press is so helpful in terms of getting access to information, whether it's the Coalition to Stop the Spread. Every community has hospitals that are putting out fantastic information. I think Selena is going to get some of Metro's examples, right, Selena, to everybody that can be used. Really terrific information. Metro is doing it, but every hospital in our state is been well equipped in putting out tremendous information, not only on those safety protocols, Mike, but also on the vaccine and the safety of the vaccine as well when it's your turn. So all you can be really helpful in that process. And the Coalition to Stop the Spread information on the screen right now. We appreciate everybody who's been spending some